My name is Jesse Myers. I'm a doctor of dental medicine, practicing digital dentistry with the belief that the whole body is interconnected, and the microbiome is at the center of everything in health. Welcome to my podcast. Enjoy.
Welcome back to the age of digital dentistry. Today we have the incredible Dr. Staci Whitman with us. And Dr. Staci is not your average dentist. She is a functional pediatric dentist who's redefining how we approach oral health for the little ones. With a focus on holistic care and the science of whole body wellness, she's making waves in the world of dentistry. Dr. Staci is also the co-founder of FYGG, or Feed Your Good Guides, a revolutionary company dedicated to empowering families with safer, more effective oral care products. Whether she's educating patients on social media about the latest dental science, advocating for smarter public health policies, or creating innovative products, Dr. Staci is truly on a mission. I'm so excited to have you on the podcast and to learn from one of the brightest minds in the space. So welcome to the podcast, Staci.
Thank you, Jesse. I'm so pleased to be here. I'm so happy that you're doing this. This is great.
Yeah, it's been really exciting for me to put out content, and we're really in a very interesting time. I feel like in general as a society, but definitely as a profession. And I had a amazing, enlightening conversation with Dr. Philippe Hugel in the last episode, and I thought that who better to bring onto the podcast than an expert in oral health, and also for where I think that the dental field should go and can go. And I feel like FYGG, personally for me, I was really trying to figure out what is a good alternative substitute that I can be giving to my patients and is actually going to be healthy for their oral microbiome. And you and Dr. Behenna came out with pediatric dentistry space.
Yeah, good question. So I appreciate your support too with FYGG. Thank you. It's been a journey. It's been a long journey. I graduated dental school in 2006. I practiced as a traditional dentist because that's how I was trained. I think it's really important to know that is essential. I do believe we need a more conventional training. I was miserable. I hated my career. I hated dentistry. I was so dissatisfied with what we did. It felt so hopeless in the sense I was just constantly like it was whack-a-mole. I wasn't really changing my patient's health. I didn't have time to get to the root cause of issues. I almost left dentistry. And I thought, well, gosh, how am I going to salvage this career? And I thought, well, I need to get more upstream. I need to catch things when they're still smoldering and before they're full-blown fires, before they're these major chronic issues, right? And so that's with children. And so I mean this sincerely. Like, I didn't go into pediatrics because I love kids. I mean, of course I love children. But I went into pediatrics because I wanted to be more of an educator. I wanted to change the narrative. I wanted to change oral health, truly. And it was felt impossible in the current practice models that I was in. So again, I went to like traditional pediatric school. I got out, and shocking, it was the same thing, except now I had 3 times as many patients on my schedule because that's the way pediatrics is. So I had even less time. And our kids are suffering. You know, the disease was even more rampant, the decay and the airway issues and the behavioral issues. And so it just became like a piecemeal approach that I personally lived a more holistic lifestyle, if you will. I really I'm very passionate about how everything's interconnected, whether body or environmentally, our planet, Terry health, energy-wise, etc. So I thought, well, I'm living this way and I'm studying these concepts and things, but why am I not applying it to the way I practice my dentistry? And so just slowly I met people in the field, biological dentists. It was actually Dr. Kelly Blodgett who really pushed me into pursuing a practice that was different. And so I did open my own practice, and it was really scary. And I just went to so many training programs. I mean, I spent tens and tens and tens and tens of thousands of dollars on various certifications and trainings, reading everything I could, flying to shadow people. I mean, it took probably a decade, and I'm still learning. But it, for me, has been very satisfying, and I'm finally seeing my patients get healthy. And when you see issues in the mouth, as you know, there are signs of bigger systemic issues. There are signs of nutritional deficiencies. There are signs of gut dysbiosis, intestinal permeability. There can be autoimmune concerns. There's gene SNPs that we should be screening for. Vitamin D, which your last guest spoke about. That's something I test for and encourage to be tested for regularly if we're dealing with dental disease. So it's so much more than just drilling and filling teeth. And while I do think that is important, of course, we need dental surgeons, if you will, or I would say more dental technicians. I think we also need dental physicians. Just like the medical model is, not everyone is just doing surgery to fix, end stage disease. And I think we need dentists to start practicing differently and looking at the whole system and metrics and data, and educating patients on the health of their whole system and how that their oral health's been impacted by that. And so that's the current practice model I have, and it's been wildly popular and very well loved. And so I'm so humbled by that. And there's a lot of excitement to expand the practice model, because it's hard to find dentists practicing like you and I do, and even more so pediatrics, so I'm working on that.
Yeah. I'll be honest, I think that you're the only functional pediatric dentist that I know. And just kind of speaking to my experience, there's a lot of parents that are coming to see me with their kids being really young, and I'm not a specialized dentist on that front, but it's really popular from what I'm seeing. I'm in a small town, and just having tons of people come and seek me through that model. But all of that is wonderful, and I have so much synergy with all of that. And I know that you and I are both on the functional dentistry locator on Ask the Dentist, Dr. Mark Brahena's website. And I think that that's how I first came aware of your work, was through Dr. Brahena. And your content on social media is just so empowering, and really is easy to digest for people. And I think that that's really great, and why a lot of people gravitate towards your work. And you're always contributing stuff out there. So definitely keep on doing that. And there's a new wave of dentists that are seeing that there's some trends in the dental field that I don't think that for a long-term career, people want to practice. And so I think the movement in general started with medicine, and it's starting to get into the dental field, and I'm excited to see that fire just kind of spread.
Thank you. I agree. The issue, I would say, and this is the issue that functional medicine colleagues will say too about dentistry, is there's no training program, right? We don't have any standardized training program. And so, as I mentioned, I had to piecemeal my education together. Not everyone can do that, nor should they. It was not healthy. It was not financially responsible. I was all over the place. I was burnt out, sympathetic overdrive times 1,000, just trying to get the knowledge. So it'd be really nice to put that all in one place, and that will exist. And so you are correct. I believe, I would argue, the only truly functional pediatric dentist, because from the medical model, like, functional medicine is foundational for functional dentistry, and that requires some functional medicine training. So I am one of, I believe, only 5 dentists in the world with my IFM certification. So I went through the Institute of Functional Medicine and became certified. And I have partnered now with 2 of the other dentists who've gone through that certification, and underneath the Institute of Functional Medicine, there will now be the Institute for Functional Dentistry. So that it will be an all-inclusive place where people can go get trained and get actual functional medicine certified. And we've had a lot of incredible excitement and feedback and support from IFM, of course, but especially from the younger generations. And I agree with you. The younger dentists coming out, they just want something different, but they don't know how to do that. And most practices that they start working at don't encourage that. It's really just the turn and burn, and how many crowns do you diagnose a day, and can we fit these metrics? And so I'm excited about it. That will be launching in the summer. And
I am very excited as well.
Yeah, we're working on the curriculum right now. I think it's going to be really, really good. I'm jealous of it in the way, like, I wish I could have sat through this curriculum. But the dentists will go and they will become functional medicine trained in what applies to dentistry, which is incredible. And then you'll go into the specialties, and we'll have functional medicine modules for each specialty. So this is appropriate for all dentists, general dentists, all specialists, and hygienists too. And so that will be summer 2025.
That is amazing. I maybe once that's up and running, I would be able to put links up for anybody.
Oh, of course.
That
In
is
fact,
interested.
the landing page is launching. This is what I have to do later today. So I will send you the link, the landing page, just to take people who are interested and their names to get on the wait list. So you will have that for this episode.
Great. Well, maybe to kind of set that up, I am very curious to know, from your vantage point as a functional pediatric dentist, how we got to this point in history with this oral health epidemic that we're seeing.
Yeah, great. I mean, your prior guest, what was his name again? I don't want to mispronounce his last name.
Dr. Hugel.
Okay. He was wonderful, by the way. I listened to that. You did a great job. It was great. I learned a lot from it. Thank you. So he spoke a lot about it. So I encourage everyone to listen to that first podcast. But essentially, if you go way back from when we were hunters and gatherers, and then we became more agrarian. So we went from foraging and eating essentially all whole foods to now processing, milling, refining, adding flour, adding sugar into everything. So there was the agricultural revolution, then there was the industrialized revolution, but this just exploded this century, especially, right? So our food landscape has changed so much. So if I'm going to pick one thing, I would say it's our food, and your prior guest spoke about how we used to be a low carb focused culture, and now we are more high carb focused culture. Vitamin D was so critical and essential for systemic health. We knew that. We talked about it. There was education. Your physician spoke about it. We can't even get vitamin D tested now. You have to beg for it because insurance companies don't cover it. And so that is a big one at my office. There's so much literature to say vitamin D deficiency and caries incidents are extremely linked. So I vitamin D test kids. I either want them to go get blood draws, or we have finger prick tests. If they're undergoing any sort of sedation or anesthesia, I really encourage the parents to do that. And I was doing a little pilot study in my office, and almost 100% were significantly deficient. I mean, in the single digits or teens. No surprise, right? So it's been our food landscape and ultra processed foods, Franken foods, you know, and it's not only the sugar, it's the flour too. So crackers, chips, pretzels, granola bars. We're on the go all the time. So we're rushing when we eat. All the other chemicals in our foods, the preservatives, the food dyes, which is something I'm passionate about, all of these things in food advocacy, and natural flavors that aren't being regulated, and, you know, things of that nature. And so they impact the oral microbiome too. So it's more than just sugar and flour, it's the oral microbiome. It's foundational. On top of that, our environment is more polluted. So heavy metal exposures, mycotoxins, all of these things, microplastics we're learning are impacting dental development. They impact nutrient absorption in the gut. So mineral deficiencies, vitamin deficiencies, and then of course also how we're breathing. So we are changing the way our faces are growing. James Nestor is the man with educating us all on that and getting that mainstream with the book Breath. But, you know, our airways are shrinking, our jaws are shrinking, and we're mouth breathing. There's more allergies, more eczema, more food intolerances and things like that too. So environmental toxicities and things. And so we're just mouth breathing more. That leads to decay, that leads to gum disease, and it changes the way we grow. So it's this really terrible, vicious cycle. And what is unfortunate is dentistry, we're not discussing all of those whys. We're just looking at the hole in the tooth and saying, well, you must not be brushing and flossing. You must be feeding your kid sugar, and you're not using enough fluoride. Here's your fluoride. You know, it's really a travesty, to be honest with you. And this is why cavities are still the #1 chronic disease globally. This is why we're not putting a dent, in the current epidemic with oral health. And it's because we're not addressing the elephant in the room, which is our food industry and environmental toxins.
Yeah, there's so much to unpack there. And I don't want to pass up this opportunity. I think a lot of people don't really realize, from people as passionate as we are about our profession, that tooth decay and gum diseases are the most widely experienced diseases in the world. And
Yes.
we're not really getting to the root of why that's happening. And I think that where we're at currently in society, I think people are really starting to wake up to how broken the system is. And I think that that's a good segue for us to kind of dive into this age-old dogma that is really starting to crumble right now. And that is the new science of fluoride. Specifically, it's been water fluoridation that's really been coming onto the national stage, and major news outlets are starting to touch base on this, that fluoride is a neurotoxin. And I was hoping that you could dive into where the science is currently at and why we really should start thinking about other options besides fluoride.
Yes. Such a big conversation. So I always like to talk about this. I like to give history. So I was trained that fluoride is the gold standard and everyone needs fluoride. And if you don't use fluoride, you're going to have dental disease, and that's the issue. And I didn't really question it. What's ironic and very hypocritical is I stopped using fluoride in dental school because I read in some magazine about its potential for thyroid issues. And my older brother was like, don't use that garbage, so I was like, oh, okay, I won't. But I still was promoting it to my patients. And then I live in Portland, Oregon. The water here isn't fluoridated, thank goodness. And I was a huge advocate. It was up for ballot measure. It was 2013, I believe, that it came up for vote. But I worked the year prior. It might have been 2012. I worked the year prior volunteering on the pro-fluoride side. I think it's really important for people to know that. I was picketing. I was handing out flyers. I was educating. I was so upset, like, how can we not put this in our water? What is wrong with everyone? A tin hat brigade, blah, blah, blah. Well, I will tell you, I hadn't picked up one journal article or attempted to do any PubMed search. I just was saying what I was taught. And I can confidently say most dentists are the same way. And I bet you would agree. I have friends when I will start who are dentists. I'll start talking about this with, and they just have no idea what I'm talking about. I'll say, "Well, do you know about the National Toxicology Program report? Have you seen the federal trial? Do you know about the verdict? What about the latest Cochrane report?" They're like, "What are you talking about?" No, they have no idea because they only are receiving the information that they're essentially fed. What they're seeing at conferences, the ADA conference, the AAPD conference, or what's on the cover, literally just the cover of JADA magazine. They're just reading blurbs, just like we do with social media, and we're just reading headlines. And it's because in dentist defense, we're too busy. There's not enough time to unpack this. You do need it fed to you, essentially. Well, I sat on a debate during that time period in Portland, and I listened for the first time to the other side. I was forced to. It was a debate, and they were so impressive. They were not the Tin Hat Brigade. These were really intelligent professionals, not just dentists, by the way, epidemiologists, endocrinologists, neuroscientists, environmental scientists, saying, "Hey guys, like, these are the concerns. Do you even know about this literature that's out there?" And what's so interesting is that, fluoride was very controversial back in the 40s. There was a push of concern that this is a toxin, that people are being exposed to too much of it through pesticides and things. We need to reduce our fluoride exposure. And then all of a sudden, because of what happened in Colorado Springs, and then they put it in the water in Grand Rapids, all of a sudden, just a second, reversal, as your last podcast talked about. Now fluoride is wonderful, but yet there was no safety studies on this. There was no literature to support it. It was just observational. And it was like, let's just brush all those other concerns under the rug. So I heard this debate, and I had a coming to Jesus moment, and I really felt awful. I mean, I was sick. Yeah. I went home and I was like, what am I doing? I don't even know what I'm talking about. You're such a phony. And so I started digging into the research, and it did not take long. If you spend 1 hour on PubMed reading about the concerns with fluoride, now remember, this was 12 years ago. A lot has come out since then. It doesn't take long for you at least to raise an eyebrow and say, whoa, wait a second. I took an oath to do no harm. I also know that cavities are not from lack of fluoride. I've always believed that. I've always been very into food and nutrition science, and it's our food, right? That's the issue. And then there's a medical ethical issue. Why are we mass medicating people? I'm a low risk human. I haven't had a cavity since I was 6 years old. I haven't used fluoride since I was 24 years old. I have no cavities. Why am I potentially getting exposed to it as opposed to someone who's high risk? We can't just be treating everyone the same. There's no medical consent. So what has happened recently? What are the concerns? Specifically with water fluoridation, fluoride now is defined as a neurotoxin, where people get all up in arms about the argument is, well, at what dose? And what we're saying is, we don't know. There's no safety studies, but we know where it is a neurotoxin. We just don't know what the lower limit is. And so in August, the National Toxicology Programs report came out. This is through the Department of Health and Human Services of our U.S. government. This report had really, truly been held under lock and key. It was only released because Judge Chen from the TSCA trial, which is the federal trial, the people versus the EPA, essentially, about water fluoridation. He said under the Freedom of Information Act, I want to see that report. Show me the report. So they released it in August, and essentially it concluded that higher water fluoridation concentrations are consistently associated with lower IQ in children. Now, it was, 18 very high quality studies. My argument would be one study should be enough, but we have 18 high quality studies that were used in the NTP report. There's over 70 studies that are just showing concern. But these are the ones they included, and it's pretty damning, So the judge took that information, and again, the burden of proof should be on safety. For some reason, fluoride, it's the opposite in everyone's mind. Dentists are like, prove to me it's not safe. Prove to me it's toxic. It should be the opposite. Prove to me it's safe, right? That's how the medications and pharmaceuticals should work. And the issue is, a lot of the studies will say 1.5 milligrams per liter of water fluoridation. So the argument is, well, most communities are supposed to be fluoridated at 0.7 milligrams per liter. But if you dig into the research, there are studies that are also showing at these optimal lower levels, there are neurotoxic concerns. And there's a halo effect, right? We don't know how much people are getting exposed to. You might drink a liter of water a day. I might drink 5 liters of water a day. Plus I boil my pasta in it. Plus I make a soup with it. Plus I'm eating ultra processed foods. It's in pharmaceuticals. It's in pesticides. I'm swallowing my toothpaste. You could go on and on. How much am I really being exposed to? What's my body weight? How much am I excreting versus another person? We don't excrete fluoride 100%. A majority of it can be stored in calcifying tissues. So we know there can be thyroid effects, neurotoxic effects. It can affect bone. It can create fluorosis in our teeth. That's the modeling. 40% of teenagers now have dental fluorosis. And it's not for, I get in arguments with dentists about this. They'll say, it's just aesthetic. That's not for you to decide. That's not for you to decide whether a patient's teeth are all mottled and aesthetically unpleasing. Plus, what is it doing to the system? If it's mottled tooth enamel, I guarantee the bone is being affected too. I digress. Okay, so the NTP report came out. The next month, Judge Chen made his ruling. We've been waiting for years. This trial had been going on for 7 years. I watched every minute of testimony. I encourage everyone else to. I have spent truly hundreds of hours taking in this information, absorbing it. People under oath, the leaders of the CDC admitting, you're right, we don't have safety data. You're right. We kind of fibbed about that. I mean, I'm not making this up. It's all there. You can go to the Fluoride Action Network and watch these testimonies, these depositions. It gives a whole timeline of the trial. It reads like a soap opera, and it absolutely should be a documentary, in my opinion. I mean, it is like Aaron Brockovich. It's like Aaron Brockovich. Cover-up's worse than crime. It basically
is, yeah.
It is.
Yep.
It is. So anyway, he ruled, the judge, there is an unreasonable risk of reduced IQ in children based on our current fluoridation practices. And he now said, EPA, you have to do something about this. You need to start regulating this more. And basically, we need safety data. The EPA has remained silent. Okay, so that came out, and you would think, oh my gosh, yay, like this... Finally, people are going to get this information. Nope, was not in mainstream media whatsoever. And so then the dentists will keep arguing the ADA, the AAPD, the CDC are still saying water fluoridation is fine because a lot of those studies were focused on higher levels than we fluoridate at currently in our country. They're ignoring the halo effect. They're ignoring, how we can't control dose. They're also ignoring all the studies that do show concerns at lower levels. The other thing I will tell you, I was actively involved in a ballot measure here just this past voting season in Hillsboro, Oregon, where they were trying to put fluoride back into the water. And we pulled reports from the water bureaus of all the surrounding communities. And guess what? the water is not 0.7 milligrams per liter. Some were as high as 2.2.
Oh, wow.
Some were as high as 3. Some were 0.9. Some were 1.1. I didn't see any that were 0.7. And then when you speak to the Water Bureau and the people putting the fluoride in the water, which, by the way, they have to wear hazmat suits to do this, they said it's incredibly difficult to titrate it going into the water. Like, it's really hard to know what amount to put in to get it exactly at 0.7. And so a lot of communities are higher. And I encourage you to reach out to your water bureau and ask them, what is the level of fluoride in my water? Like, I think that'd be very interesting for you to learn about that. So dentists are now saying, they're still in support of it for the most part, although it's getting more attention and people are talking about it. It's a national conversation, and I'm very excited to hear some more critical thinking happening. But on top of that, people will still say, but it reduces cavities by 25%. What about the poor communities, the poor kids? They only eat garbage food, right? They don't have access to dental care. And I would argue those children are the most vulnerable for neurocognitive issues. They compare the neurocognitive issues. It's mostly IQ drops that they're seeing. There's some neurobehavioral studies too. The IQ drops can be on par with lead, 5 points. That's a lot. And so these vulnerable populations, those kids, they can't afford to lose 5 IQ points. And who are we to decide that for them? So, but my argument with that 25% that people are saying, including the ADA, it's not accurate. It's not accurate. And so last month, the Cochrane report, or I think it was in October, which is the gold standard, of evaluating effectiveness of health interventions, released a report of 21 very high quality studies and said, whoa, not so fast. Actually, it might be only reducing decay rate by like 3%, or 1/4 a cavity per human, or one cavity per every 4 children. So 1 less cavity per 4 kids, which is not statistically significant, nor is it's a risk benefit thing. So we're choosing brain health over dental health, or dental health over brain health. I picked the brain. I'm a dentist, you are too. We're trained to fix a tooth. If a tooth gets a cavity, I'm going to first try to remineralize it, educate the family about why it happened, look at nutritional deficiencies, try to optimize that patient. But worst case, sometimes I have to fix it. I know how to do that. I don't know how to fix a brain. We have one shot to fix a developing child's brain. So those are the controversies, and then I will just say, listen, if people really want to use fluoride, just use it topically, toothpaste. And I don't love the argument that these vulnerable communities don't have access to fluoride toothpaste. They do. It's everywhere. You can get it at the dollar store. It's given out free at volunteer vans, and like fluoride. It's not that hard to come by topically. But again, it's not the main issue. The issue is our food. And it's about educating these families about proper nutrition, getting them access. Let's have the SNAP program cover healthy food instead of Coca-Cola and Cheez-Its. Let's stop subsidizing soy and corn for our high fructose corn syrup, and let's start getting more subsidies into regenerative farming. Let's create programs to educate people about how to cook food and prepare. Let's get like home ec back in curriculums. These seem like big undertakings, but when you think about it, some of them are just so obvious to really deal with the root cause issue. And of course, if we did all these things, it wouldn't just be teeth that benefited, it would be whole bodies that benefited. I mean, we're so chronically diseased right now. We're so chronically diseased, and it's all because of our food.
Yeah, and it's not just one generation. And note that you have seen this yourself in your practice, but I'm seeing families that likely the epigenetic influence of these poor food choices that we have are affecting how our bones and our minerals are being able to to grow.
Yes,
in
hypoplastic
3 generations.
enamel.
Yeah.
Hypoplastic enamel is my new, once we get through this water fluoridation and the Kellogg's, food dye stuff, that is my next big sense of purpose, is to just start ranting and raving about the hypoplastic enamel epidemic. It is becoming, I can't, every kid that comes in my office has some degree of hypoplastic enamel, I swear. And it is, I believe, because of the epigenetic components that the great-grandparents were kind of nutritionally deficient, the grandparents were more so, the parents were more, now the kids. And they just don't have enough nutrients to properly develop teeth. So these kids, these babies' teeth are coming in crumbling. And the parents, the moms especially, get shamed and blamed. This is because of your breast milk. You're not brushing your kids' teeth. What are you feeding? Are they going to bed with juice? And the answers are no. That's ridiculous. Breastfeeding is Mother Nature's most important thing to be doing for a baby, if we can, especially for airway and facial development and immune health. We wouldn't have evolved for breast milk to just rot our teeth. It doesn't even make sense. And it's because these teeth, the enamel isn't acid resistant anymore. There's no mineral content there. And I totally agree with you. And our soil is depleted too, of course. And so this is part of functional dentistry, is really speaking about where are our deficiencies. And very commonly it's vitamin D3 and K2. It's very commonly trace minerals, and especially magnesium. And so I recommend a lot of my patients go on supplementation because, I prefer to have labs to draw that conclusion from. But we know we're really vitamin D deficient globally, and we know we're very mineral and magnesium deficient, and that affects teeth. And then our microbiomes are changing too. There's studies to show that our commensals we're less diverse, our microbes are less diverse, and that makes us more susceptible to pathogens. And so that carries throughout families too, and so if your parents have a predisposition to pathogenic bacteria, well, you will too, because the bacteria are transmissible. And our families and our tribes, we tend to share the same bugs, and so that's why you see in a family, they'll say, well, I just have soft teeth. And it's like, well, it's much more complicated than that, right? So it's a big deal. It's overwhelming. And so because of that, I can see why dentists are like, I don't have time for that. Here's your fluoride prescription. But as a functional dentist, that doesn't feel right to me. That's a pharmaceutical Band-Aid, right? I'm not fixing the problem, and I'm just going to carry on more epigenetic issues. We're not going to deal with the issue. And so the kids are just going to get sicker and sicker and sicker. And so I'm excited. I feel like there is a shift right now with people wanting change, people wanting answers, people wanting to do things differently. We've lost so much connection to getting back to the basics, to nature. Like the human body is pretty incredible if we let it do its thing, and if we keep it optimized, and that's the hard part.
Absolutely. Yeah, no, as I had said earlier, I really feel like people are awakening to how broken the system is. I mean, we're one of the top spenders in healthcare, and we're ranked 79th in health outcomes. And I am really frustrated, but it's also, I feel like, part of the grieving process, maybe, where all of these people who, it's so obvious that they haven't read any of the studies that have come out, and they're just regurgitating the same information that we've been told all along. And kind of some of my story in this, we had a mock water fluoridation debate in dental school, and I was the president of the local dental society, and I was on the pro-fluoride stance myself. And I'm not saying this to lift up my own self-image here, but my professor actually called me out in front of the whole class and was like, you just represented the water fluoridation stance so well. And while I was preparing for that debate, I had come across the NIH study that was published in JAMA Pediatrics, which is a very highly renowned journal in the field of pediatrics. And I was seeing that at 0.7 parts per million, we were seeing these IQ deficits in these children. I believe it was in Canada.
Yeah, the Rivka Green study.
Yes. Mm-hmm. And through that, I really started to question, like, okay, science always changes. I need to be on top of this, and I'd stayed on top of it. And all of these new studies that kept on showing the same repeating pattern, which was that there was these IQ deficits in the optimal range of what we are supposed to be fluoridating our municipal systems across the United States. And I know that you had touched on this study in your social media, but there was another study published in JAMA Network that was pretty alarming as well. I'd hope that you'd touch base on that.
Yeah, well, yeah, so there's been so many studies, and this is one of the counter arguments from the pro side is they'll say, yeah, but these studies, they're in other countries. There's a Canada study, there's a Mexican study, there's a Japanese, yeah, but what about the US? And that's just so ridiculous. Like, humans are humans, okay? But, so this was a United States study, yes, and yeah, JAMA published it again, and it was about, maternal urinary content of fluoride, and in this situation, it showed neurobehavioral issues in the kids to a statistically significant manner. And so, but no one covered this article. Do you know the JAMA Pediatric? So for anyone listening, if there's a dentist out there listening, that and you're genuinely interested in this, but you're like, I don't have time to do what you guys do. And research, because it does take a long time to find this stuff and read through it and really try to understand, was this a good study? Was this not a good study? The Fluoride Action Network is incredible. Everything basically that was part of the NTP report, the Cochrane review, and the trial is there. And the whole trial, including excerpts from the testimonies, the timeline, little YouTube clips, videos are there. But then also there's a really great podcast, and it was JAMA Pediatrics, and it came out in 2019. And it's only 12 minutes long, so it could not be easier. And it reviews that Canadian study. And it's so interesting to listen to it, because you can tell the editor and his colleague, they hadn't prepped for it. They were riffing. And you can hear them go from the beginning of the podcast to the end and kind of come to the same conclusion. Now, they tried to rip apart the study, and the editor was like, listen, I couldn't. This is a very good study, which is why I published it. He got a lot of flack for that. A lot of flack for that. In fact, he had to write a response to it. He's also quoted in the Washington Post as saying, based on these latest findings, I would not I would not suggest my pregnant wife drink fluoridated water. So at the end of the podcast, you have to listen to the very end. They both say, well, gosh, based on this, I think that pregnant women and kids should be filtering their water and not drinking fluoridated water. And then the point comes up, well, people can't afford water. Some people can't afford water filters, and bottled water isn't the solution either for an expense reason. Microplastics, that's a whole other conversation. And then let's talk about environmental factors too. So these are not good solutions. Let's just get it out of the water. That's the good solution. So I really recommend listening to that podcast. I really do. But yeah, so there's just been so many studies. And so that United States study, I think, was very powerful too, to show, well, it's maybe more than just IQ. Maybe it's neurobehavioral issues. We know there's a lot on thyroid. It affects mitochondrial health. It's an electronegatively charged, the most electronegatively charged element. What is that doing in our body? Well, it's competing for iodine. It's affecting our mitochondria. It can lead to inflammation. Oxygen is supposed to be the most electronegative element in our body. So if you're ingesting fluoride, like, what is that doing? And this is a point I haven't heard anyone talk about, except Marty Mackley, who I think was nominated for, was it FDA? recently. He was on the Drew Perowit podcast. He's wonderful. He was at the Senate hearing. In his podcast, he's an MD. It's the first person I've ever heard talk about this. Fluoride is antimicrobial. Okay, it's not selective. So dentists, we love that. We're like, oh, and it's antimicrobial, it's antibacterial. Great. What is it doing to the beneficial and commensal bacteria? No one's studying this. You're ingesting it. What is it doing to the gut microbiome? No one is talking about this. I mean, I have significant concerns. If all day you're consuming an antimicrobial agent, again, we just need to use some common sense here and at least say, woo, let's look into this, especially where we know the gut microbiome is so important for serotonin and you know, all of our neurotransmitters and absorption and vitamin assimilation and things like that too. So it's a mess, and I just think we need to take it out of the water, as a majority of the other world has. That's the other thing for those listening. Perhaps you don't know, we are one of the last countries to still fluoridate. 97% of the world, most of Western Europe, Japan, etc., you can look this up, have removed it from the water. This is such a United States centric argument and conversation and controversy. So you can also look at World Health Organization data and see that our fluoride levels are the same. Our cavity levels are the same in fluoridated countries as they are in unfluoridated countries. And another argument you're going to hear is that fluoride was removed from some communities in Canada, and that they say the cavity rate went up after that. What they don't show you is the cavity rate was already on the rise. Okay, it was already on the rise. They took away fluoride, it kept at its same trajectory. These points matter when you're talking about science, right? So you got to dig a little deeper. And again, I would argue even if cavities did increase a little bit, which I don't believe they would, it's brain health, it's systemic health, it's all these other issues. Why are we choosing teeth over, you know, these other components of a child's health and wellness? And who are you to make that choice for that parent? The parent should make the choice on that.
Mm-hmm. Absolutely. Yeah, it's I feel like it is remnants of the disjointed medical system that we have, where we isolate things into separate components in 100%. The body.
I think dentistry really does that. Sorry to interrupt, but
sure,
you know, we get some very basic medicine, and every program's different, but I believe dentistry should be a specialty of medicine. That is what I believe. I believe we should go through 8 years and a residency and a fellowship. I really believe that. I know people will think I'm crazy, but how else are you going to know how it's all connected? I mean, hormone pathways and cardiometabolic health and GI health and nutrition. Like, you know, we didn't get any real nutrition. So of course we're just going to look at things myopically and look at the tooth, because that's all we were ever trained on, was just the tooth. Fill the hole, you know, pick up the handpiece and figure it out. So anyway, I just think we're really missing the mark, and I think dentistry is the worst for compartmentalizing, that it's just here. They forget there's a whole human attached to that mouth.
Yeah, and it can be really, really easy to get that tunnel vision, especially if, let's say, somebody's got 32 teeth and every single one of them has tooth decay on it. There's a lot of problems that need to be fixed.
Yes.
So
I know.
But I maybe this is a good segue. I know a lot of people are reluctant because they think that the tooth decay rates are going to go up if we remove fluoride from the water. But this is hot off of the press. This was just released this year. I believe it was in October. But the Journal of Dentistry, they did an updated systematic review and meta-analysis of all of the clinical evidence of caries prevention of this new ingredient called hydroxyapatite. And I'm paraphrasing and quoting them, but they said that hydroxyapatite is an ideal substitute for fluoride in toothpaste and mouthwash that is able to be used in young children and in adults, and it is a safe substitute. So for anybody who doesn't know what hydroxyapatite is, can you explain what this amazing biomimetic ingredient is?
Yes. And hydroxyapatite isn't that new. It's just kind of new here in the U.S. and new here with our dental organizations talking about it. But it has been around since the 1970s. And that is around the late 70s, early 80s was when countries like Japan, Italy, they jumped on it and they started adding it into their toothpaste. And so we've had clinical evidence and in vivo, in vitro studies since then about the magical powers of hydroxyapatite. So hydroxyapatite, it's calcium and phosphorus. It is what comprises up your enamel. 97% of your enamel is made of hydroxyapatite crystals, calcium and phosphorus crystals, and 70% of your dentin and bone are made of hydroxyapatite. Hydroxyapatite has been used in medicine, particularly with implant surgeries and bone graftings and things for decades and decades and decades. And a lot of the controversies that we're hearing about it, they're not in the medical community, it's the dental community. And I have suspicions about that, but we can get to that later. But if you look at the clinical data, it is comparable to fluoride, and actually more data is coming out now showing it outperforms fluoride. And I am privy to some recent research that shows it blows fluoride out of the water, especially if you're using nanohydroxyapatite. So Boca was actually one of the first companies to bring it to the US, so hats off to them. I think that was 2015. But again, this has been used in other countries. Apogard in Japan is the OG. It's been around since the 80s. And in Japan, that's mostly what they use in their toothpaste is hydroxyapatite. A lot of Western European countries are moving that way too, Italy, etc. I will tell you, since I started implementing it in my practice, which was probably about 2015 when Boca launched, I was lucky that I just heard about it. I have seen my patients get so much healthier than using fluoride. And I think part of it is because of that antimicrobial nature of fluoride. That's something we're not talking about, that we are damaging the diversity and the commensals in our mouth. Hydroxyapatite won't do that. And so what does it do? There's micro and nano versions. I am a fan of nano because I have found it works much better than micro, and there are studies to support that as well. But it can help with sensitivity. It helps with prevention, of course, remineralization, cavity arrest, and it can brighten and whiten too. And if you're using a nano version, it's because it will not only occlude dental tubules, but it can actually get into the dental tubule and kind of recreate the structure of the cavitation. And so I do see a lot of remineralization in my pediatric patients who are using nanohydroxyapatite. We avoid a lot of fillings at my office, a lot of sedation, a lot of anesthesia, and it's incredible. It's truly magical. I have been using it myself now for all these years. I would never go back. Your teeth feel amazing with it. So I think there is a movement. You know, a dental code was created January 1st of 2024 for hydroxyapatite varnish. Unfortunately, a lot of insurances still aren't covering it, but I think that will change. It takes time. It was the same when silver diamine fluoride came on the scene. They were denying it. It's going to take time. It'd be really nice for the ADA to back it. They will only back fluoride. The FDA will only back fluoride, but I am hopeful in these next years with some changes at a government level that will also change, because there are other things that remineralize teeth. Theobromine is also another wonderful agent that can remineralize. I will tell you, it doesn't work as well as nanohydroxyapatite, but there are options. It's not just fluoride, you know. And so so I met Dr. Berhenna on Instagram. We obviously have a lot in common. We talk and kind of rant and rave about things. We were working with some of these toothpaste companies, either just as consultants, unpaid. I was always unpaid for my consultations. I did become an affiliate, on social media for some of them because I believed in the product so much. But he and I would just discuss these products are great, but they still have surfactants, they still have emulsifiers, they still have really strong essential oils. And so he and I are both very microbiome focused. And so that is why we created our own toothpaste brand that not only remineralize, but really our whole brand mission is about the oral microbiome. That's truly why we created it. It's oral microbiome supported. So we have prebiotics and amino acids in there to boost and modulate the microbiome, but also have this amazing, incredible remineralizing agent. And we use Nanoxam from Portugal, which is the highest quality globally. It's the only version of nanohydroxyapatite that has been scrutinized and approved by the scientific community for consumer safety in the EU. Again, of course, the FDA hasn't even looked at this. So, people ask, is it FDA approved? Well, no. But many people don't realize fluoride isn't FDA approved for the way that we're using it. It is being used off-label as a desensitizer. It is not approved for cavity prevention or remineralization. And fluoride prescriptions are not FDA approved either, yet we're still prescribing them. So that is my counter argument to that. But the SCCS in the EU, which is a very well regarded oversight committee for ingredients in consumer goods and cosmetics, has approved it after nearly a decade of scrutiny. They approved Nanoxam, which is a proprietary blend. It is heavily regulated. It's biomimetic. I encourage everyone to head to Fluidinova's website to learn more about it. They have such integrity. They're tested. They've done testing in vitro, in vivo. Because I know this will be coming. I heard nanohydroxyapatite crosses the blood-brain barrier, affects lungs. Okay. So we have to be very careful what we're listening to on social media and trying to see who is saying this messaging. I think some of it are people who really just don't understand the science. They look at a headline and they regurgitate it. And others have maybe some self-motives involved too, okay? I'll just leave it at that. But when you look at the studies, I've never seen a study talking about blood-brain barrier, but the cool thing with Nanoxam, it was shown to dissolve in solution in just minutes, completely into its mineral components, so it will not cross epithelial linings, which means there's no way it could get into the blood-brain barrier. And they're continuing to test this constantly, including human trials. So my argument is, with some of these natural toothpaste, what level of scrutiny does your toothpaste have that is that highly regarded? I will tell you, naturally sourced hydroxyapatite that is from the soil or from bone or from shell or, like eggshell, I would want COAs on that. So a lot of those, because we've polluted our environment, are very high in heavy metals. And ironically, they can be very high in fluoride, which is in the environment. So just because it's from soil or from eggshell or from bone, especially bone, holds on to heavy metals. That's where we hold on to our heavy metals. So you're using bone in your toothpaste. What is the heavy metal content? You really do want to know. So that's my answer to that. Dr. Berhenna and I, we actually waited to formulate until that SCCS report came out. We would have launched years ago. We wanted the SCCS report because we didn't know what direction we were going to go in. We believed in nanohydroxyapatite. We wanted that level of science and research and human trials and safety assessment. And then the report came out, they approved it, and we said game on. And they keep reassessing it and they keep approving, but it's only Nanoxam from Portugal. So I do caution people to not use hydroxyapatite sourcing that isn't from a manufacturing facility that has been approved. And right now, the only one that's been approved is Fluidinova. There's a lot that are being sourced, unfortunately, out of China, and just who knows what the level. I mean, some of it is who knows if it's even hydroxyapatite. Again, what's the heavy metal content in that? How was it handled and stored? Are there impurities? So But what's so interesting about this, no one asks about fluoride in their tooth. Where's the fluoride come from? It's so funny that hydroxyapatite is under such a microscope. And I think that there's reasons for that. There's people pushing back on it because it's threatening to the fluoride industry, to be honest. I mean, I think some people are really worried. People are worried about it, so.
It is, and at least all of the clinical studies that I've read, I really do think that it will be the replacement. At least in my hands, it's the replacement for fluoride. And there's actually a really cool backstory to how we started using it for remineralizing our teeth. I don't know if you know anything about that.
I do, but you go ahead. No, you can go. Is it NASA? Is that what you're talking about?
Yeah.
Go ahead.
From what I understand, they were starting to see that these astronauts were having demineralization in their teeth, and so they started using hydroxyapatite to help to remineralize their teeth, and that's how we started looking into it.
That is right. And then my understanding is then the Japanese caught wind of it and created the patent for it, or maybe they bought the patent from NASA. I'm not totally sure of that fact right there, but regardless, and out of that came Apogard, which is still a wonderful product, which is a Japanese toothpaste. And I have a lot of followers and even patients that they just love their Apogard. And there's so much science and data behind it. So the whole thing with this is haters are going to hate. You're going to, as a dentist, you're going to have patients coming in saying, I don't want this. I don't want to use that. I read this online. Our jobs are just to educate and then let them make their decision. But I would love all patients to be using it because they will get healthier. I really see teeth get healthier. I see oral microbiomes get healthier. I just see the tissues get healthier. So anyway, but I agree with you. I think it is going to become the gold standard here in the U.S. I do. I think it might happen sooner than later too. So we'll see.
Yeah. Well, we definitely need, I think substitution therapy is something I'm a big fan of. And so you have to have something to be able to take the place of whatever has been the gold standard. And, and I feel that hydroxyapatite can do that. I've seen a lot of people talk about the toxicity concerns with the nano size versus the micro size. And I know that you've already touched base on this, but at least as far as I have seen, it seems that it's very safe to swallow, that it's just going to dissolve into the calcium and phosphate ions and really serve as a reservoir to help mineralize the teeth. So
it boosts your saliva. It basically supercharges your saliva, because our saliva is truly what remineralizes, right? That's if we're perfectly in balance and your saliva is healthy, we demineralize, we remineralize, and our saliva comes in to save the day with that remineralization. The unfortunate part is we are all deficient. We're not mineralized, our saliva is not healthy, we're dehydrated, all of these other things. So it does. But yeah, you're exactly right. It dissolves in solution, stomach acid and saliva within minutes. This is what the SCCS showed in their human trials. What's interesting is a lot of there's one study in particular I've seen on social media a lot. And the study, if you read it and not just the headline, it was an animal study where the purposes of the study was to study the kidney. It was a kidney study. And so the researchers injected the animals with a high enough dose of hydroxyapatite to induce kidney failure because they wanted to study the kidney. And so people are pulling out little blurbs from that saying, look, it causes kidney failure. It's like, okay. It wasn't in a toothpaste form. It was intentional. They injected the animal with such a high bolus because they wanted to induce kidney failure. If I injected you with enough, I don't know, orange juice because I wanted to create some sort of end-stage organ failure in you, I could do that, So context matters. Obviously, context matters. You need to read the methods and materials,
Yeah, well, I had read the latest toxicology study where they were putting concentrations that are far above what you would be exposed to in toothpaste. And they found that the cells that usually we would find lining our mouth, that they couldn't find any signs of cytotoxicity.
Correct. The stratum cornea, it won't permeate there. Yeah. So when they did cellular cultures and they looked, there was no calcium particles there. It does matter too. Particles. So we can talk. It should be rod shaped. It shouldn't be needle shaped.
Yeah.
There needs to be a certain aspect ratio. That's a lot for lay people to get bogged down with, in my opinion, but this is where I just use Fluoride Nova. And I will tell you, these are the companies I know of that are using Fluoride Nova. I'm sure there are more, I apologize, but we are using Fluoride Nova. So FYGG uses Nanoxam. Boca uses it. Risewell Pro uses it. Cocoa Floss, or I guess it's Cocoa Paste, uses it. David's. Biocidin now has a remineralizing toothpaste. They use it. I believe Carefree has a product, or they have one coming out soon. And I know a lot of these founders, they are so ethical, so smart, do their due diligence, have research teams. And so of all of these very reputable companies are using this, and a lot of them are biological, holistically minded functional dentists who have founded these companies. I think that's incredible. These are people I really respect and admire. So I'd be very cautious using brands that aren't using Nanoxam. And there are some out there, and they will tell you, we follow SCCS guidelines. I would be very cautious with that.
Okay.
I'll leave it there.
Yeah. Well, I feel really safe and very very happy to be able to offer URL's products to my patients.
Thank you.
I love the name, and I also love, you had said that there are some peptides in there. There's one of those that I'm a big fan of that you guys have in the formulation, and that's arginine. I was hoping that you could just kind of touch base on some of the awesome aspects of arginine for oral health.
Yeah, arginine in certain doses can act as a prebiotic in the mouth, so it's feeding healthy bacteria and commensal bacteria, but it also will modulate the biofilm, so it makes the biofilm essentially less sticky, so you aren't as prone to plaque. I'm just trying to oversimplify it here, but it's really incredible. And the cool thing with arginine, it's not controversial, and some of the big companies are even incorporating it into their toothpaste now too. So that's why we added it. We also have other prebiotics, and we have some very cool products coming out next year that will be really the first ever launch in certain categories that I can't share right now, but just stay tuned, that I think everyone will be very excited about.
Okay. Well, I've liked the current selections that are online right now. Could you walk through the different flavors that you guys have?
Oh, yeah. Yes. So it was important to us not to have really strong essential oils. So we have very mild flavors, and we do have xylitol in our toothpaste because that acts as a prebiotic also, and can help modulate the microbiome too. And there's so much data and studies on that as well. But we have mild mint because we don't want it too strong, because we don't want your toothpaste to burn or foam. That burning means your mouth's getting carpet bombed. So it's a very mild mint, and most kids do great with it. It kind of tastes a little bit like a junior mint. That's what I use. I love it. We also have a vanilla. So it kind of tastes like cake frosting, I guess, although it's, again, very mild, so some adults will use that. And then we recently just restocked 2 flavors, coconut cream, which if you don't like coconut, you're not going to like it, but if you do, it's so good. And then there's chocolate, and the chocolate, it has cacao in it, so it has the theobromine benefits as well. And I feel guilty about this product because it tastes so good. It tastes like chocolate mousse, kind of. Kids, you really do need to monitor your children, not because there's any danger of them eating the whole tube. There's no poison control label, but it's a lot of money just to waste with your kid eating it. But what's so cute is parents are sending me videos of their kids, it's specific to the chocolate, brushing their teeth and then saying, "Can I brush my teeth again?" Which the parents are like, what is happening here? They never ask to brush their teeth again. So those are the flavors we have currently. We also have a varnish. So it's meant to be a replacement for the fluoride varnish in the office. It also has the prebiotics and amino acids in it. We took out the hexane derivatives and the propylene glycol and the polyurethane, which many people don't realize is in fluoride varnish. If you don't believe me, look at the MSDS. I was shocked when I looked at the MSDS for fluoride varnish. It's like fluoride is the least concerning thing in it. But anyway, so it's replacing that. And then we do have some double-blinded peer-reviewed studies coming out and some clinical trials underway, and we're very pleased with the results. That's what I will tell you. So they were done
Awesome.
Third party. Yeah, they're going to be published and presented actually next year. So those will be coming out really soon.
Great. I can't wait to read those studies. I really am such a big fan of hydroxyapatite and nanohydroxyapatite.
More recent data, because it really does outperform fluoride, and it's the nano is outperforming fluoride for remineralization, for sensitivity, for whitening, and Fluidinova has all kinds of research on their page. We do too on FYGG and my social media platforms as well.
Perfect. Well, I've got some closing questions for you. So I know that you were recently nominated to be a part of the oral health advisory for the new administration. I think we've touched on some of them already, but what would be some of the top changes you would make if you were to advise how the dental field should go as a whole?
Yeah, gosh, there's so many. I actually have my list all written out. This is in no particular order because I really do need to think about that. I think the educational burden, the debt burden needs to change significantly for students. I think that's impacting our field a lot. So people can't practice the way we're talking about because they're trying to pay off this huge loan every month. And so that is where turn and burn dentistry comes in. That is where they're like, I don't have time to educate and run labs and sit down and do health coaching with my patients. I'd like to see our education change too. I mean, I think we need more nutrition. I think we need more medicine. I think we need more oral systemic, more talk about salivary analysis and oral microbiome testing, and it's really hard because we do have to learn to fix teeth too. Like, you're in your simulation lab. That's an important component. This is why I think dental school should be longer. I'm certain that is not widely accepted among a lot of dentists. You're just like, get me out of school. But I really do think to be an optimized clinician, I think we need more time. I would like to see, this doesn't directly relate to dentistry, but it does. The FDA, why is food and why are drugs under the same administration? Like, we need to be separating these agencies because it affects, there's so much conflicts of interest. There's so much improper oversight, and so I think by doing that, we will see more opportunity to get things like hydroxyapatite, quote unquote, approved. I'd like to see a lot of shifts in the ADA. People do not realize what the ADA is pay to play. I am personally not a member anymore. I dropped my membership years ago. It is more complicated than we can get into right now, but I would like to see some more integrity there, I think, and more support of the actual dentists, and not special interest, if you will. I would like certain materials banned. I mean, mercury needs to go. What are we doing? Europe, it's banned in Europe. I believe it's effective January 1st. It is out. And this is not for just human health, but this is for environmental health. Where's all that mercury going down the drain? Yes, we have the traps, but come on. So there's environmental factors there. We're too far advanced to be still putting mercury in people's bodies. Formocreosol, that does have more regulations. I think it actually was finally banned, but it's not for years in advance. Like, why are we putting this in open pulp chambers in our children? Of course, water fluoridation is a big one too. More access. I'd like to see more advancements in research. Like, we need to be funding not just the same old fluoride research studies. We need to be expanding beyond that and putting our dollars more in the oral systemic connection and alternative materials, biomimetic materials. I think AI is huge. I'm very excited about what AI can do for dentistry. So those are some. I know I'm missing a bunch, but yeah.
No, those are all really good changes. Insurance
is a big one. Again, that's a long, big, complicated one. But it's really hard to motivate a dentist to practice like you or I do. How much stuff do you do a day for free? A lot.
Yeah.
I would argue 80% of my appointment is me just talking and educating. I don't get compensated for that. I made all these very elaborate educational handouts for my patients so they could go home with more information. I personally paid for those to be designed, to be printed. I don't get paid. I don't get reimbursed for that. So we need to be reimbursing true preventative care and health coaching and education and airway screening and all of these things too. And that's how we're going to move the needle. I believe that.
Yeah, no, those are all wonderful things, and I'm extremely hopeful for what's to come in the future.
Me too. I am too.
Well, how can listeners connect with you and learn more about your work and support your initiatives?
Yeah, thank you. So I do a lot of educating on Instagram. So I'm Dr. DOCTOR _ Staci, STACI. I am probably moving a bit more off that platform. I haven't been super pleased with Instagram lately, the algorithm and everything. I mean, we'll see, but I'd like to get more on X and TikTok and YouTube. It's just so hard. You don't have there's not enough time in the day, but you can find me there. I have a website, drstaci.com. It's spelled out, drstaci with an I.com. I have a lot of education and blog posts there. I do online consultations too for families that want to come see me or that can't come see me. My office is called NOPO Kids. It's in North Portland. That's what NOPO stands for. So it's NOPO Kids. If someone's listening and they maybe want to come visit me. And then of course there's FYGG.com. You can use Staci15 for a discount. What else? Stay tuned for the Institute for Functional Dentistry. Very excited about that. So if you're a dentist that's listening, it's going to be like going back to school. This isn't like it's legit. You're going to get extra letters behind your name from this. So it is a commitment, but it's well worth it, and you're going to come out super educated on functional medicine and functional dentistry. So we're really very excited about that. I'm hoping to change the industry that way.
Yeah, well, this dentist is very excited for those changes. So,
cool.
Staci, it has been such a joy to be able to share a conversation with you and have you on the podcast.
Thank you, Jesse.
Thank you so much.
You're doing good work. Yeah, you're great. You're doing
Appreciate
such good work. It's so nice to meet other people so committed to the cause. So I appreciate you.
Yeah, likewise. And we need more of us out there. So
we're working on
again,
it.
Thank
this
you.
helps. This helps. One dentist will listen to this and say, "Oh, I've been wanting to practice that way too." It creates it makes it so you don't feel like you're such a lone wolf, you know. And then you get confidence that, like, okay, the way I'm thinking actually is okay.
Mm-hmm.
It can help.
No, definitely. I wholeheartedly agree with that. But again, thank you so much for sharing your Saturday afternoon with us. And this has been another episode of The Age of Digital Dentistry. Take care, everyone.